Hello everyone, I'm Anika Bora. Today I will discuss caption 3 about trauma informed care. So first in prevalence, so domestic abuse affected around 1,27,000 people in 2021, mostly women aged from 25 to 44. In the next slide, in the solution, the first is training, educate healthcare providers on recognizing and addressing abuse. Second is screening, implement sensitive routine screening in healthcare settings. Third is safe environment, create confidential space for victims to disclose about and get support. Next slide, please. Leadership and implementation. In the leadership, inspire and educate staff on compassionate care. In the second phase plan, prepare pilot tests and evaluate and fully implement TIC. In the last slide, it will be outcome or quantitative. So in the screening, increase routine screening for abuse, and second is health monitor reduction in emergency visit and healthcare utilization. So this strategy will be enhanced care for domestic abuse. So next slide will be presented by Rajdeep Kaur.
So next, hi, I'm Rajdeep Kaur. So I will be presenting the evaluation outcomes. So in the qualitative data, the patient feedback is taken. Around 70% patient feel more safer, and staff feedback, it tells around 65% of staff feels inadequate in caring for the domestic abuse cases. So next comes the barriers and solutions. So in the barriers, number one is resistance to change and lack of awareness. So in order to overcome this, we will provide comprehensive training programs, and our goal is to go for 100%. Next is limited resources and confidential spaces. So here the Ontario is providing 35% of hospital space for the abuse victim, where we are hoping to bring it to 70%. So next is the impact on the stakeholders. For staff, 60% improvement has been seen. For leadership, 70% improvement has been seen. And for patient, client, and families, around 85% of positive feedback is also seen. Next is the plan of sustainability. It is done in a role play video. So I'm going to play it now.
We will create and deliver TIC training for shelter staff, healthcare providers, and social workers. Pilot programs will be launched in selected shelters to test TIC effectiveness. Strategic partnerships with hospitals, mental health services, and community organizations will be established to support women in shelters. Baseline data on abuse identification, health outcomes, and satisfaction will be collected to set evaluation benchmarks. We will evaluate pilot programs using qualitative and quantitative methods to identify strengths and areas for improvement. Training modules will be refined based on feedback to enhance effectiveness. TIC practices will be gradually expanded to more shelters across Ontario, and community outreach will involve awareness campaigns and educational workshops on domestic abuse and TIC-informed care. TIC practices will be fully integrated into all participating shelters to ensure consistent care. We'll continuously collect and analyze data to monitor progress and identify needs. Ongoing support and supervision will be provided to maintain high standards and prevent burnout among staff. We will strengthen partnerships with mental health services, legal aid, and community resources to offer comprehensive care. Advanced TIC training programs will be introduced to keep staff updated. Leadership programs will be developed to cultivate leaders committed to sustaining TIC practices. TIC practices will be embedded into organizational policies and culture to make them integral to shelter operations. We will conduct a comprehensive evaluation of the 5-year program, publishing a report on outcomes and best practices to encourage broader TIC adoption. A long-term sustainability plan will be developed to ensure ongoing support, funding, and continuous improvement of TIC practices. Transformational leaders will promote a compassionate care culture, encourage staff engagement, and drive continuous improvement in TIC practices in shelters. Watson's theory into TIC practices ensures that care for women in shelters is compassionate, holistic, and centered on healing and recovery. Training coordinators will deliver TIC programs with support from staff and volunteers. Funding will cover training, outreach, and evaluation. Data systems will track outcomes, and digital platforms will aid training. Partnerships will establish support networks. Continuous education and comprehensive materials will ensure development. Shelters will provide private spaces and safety for women.
So next is a list of references. These are the all references that we used. And lastly, we want to say you a big thank you.